Surgical aortic valve replacement SAVR and transcatheter aortic valve replacement TAVR, also called TAVI, transcatheter aortic valve implantation, are both effective methods for treating adults with severe symptomatic aortic stenosis. Early mortality and stroke are a bit lower for TAVR, but vascular complications, paravalvular regurgitation, and need for permanent pacemaker are higher for TAVR. As expected, length of hospital stay and recovery are significantly shorter for TAVR and hence often preferred by patients. TAVR was initially approved only for high-risk patients. Later, the indication was extended to low-risk patients as well. A point to be considered in younger patients is the long-term durability of bioprosthetic valves used for TAVR. That is because the procedure has been widely used only recently and only time will prove that.